Hi, my name is Tim Peterson. Today is October 1st, 2021. Today I'm going to be completing the Module 3 video about the integumentary system. As you can see, I just have a one-sided sheet of paper here with some terms I'm going to use, which include epidermis, the layers, stratum, corneum, lucidum, granulosum, spinosum, and basalum, the dermis with the two layers, reticular, and papillary, the hypodermis, hair, nails, sebaceous glands, and sweat glands. So when thinking about the integumentary system, we can think that the primary purpose of this system is to serve as a barrier to the outside world, so to protect our body from our surroundings, whether that's something like bacteria or some other foreign agent. And when we think about the integumentary system, the first thing that comes to many people's minds is the skin. So I'm going to talk about the various layers to the skin. We can start with the outermost layer, which is the epidermis. And within the epidermis, it is made up of 5 layers within itself. So going from the deepest to the most superficial, or the most interior, to the one on the very outside of the epidermis, we start with the bottom one, which is the stratum basale, and then the stratum spinosum. Then we have the stratum granulosum, the stratum lucidum, and then the stratum, so the outermost layer, stratum corneum. And within the epidermis, we need to also remember that there's kind of like 2 kinds. We have thick skin and thin skin. So thick skin occurs on the palm of our hands or on the bottoms of our feet, and it contains all 5 layers that I just mentioned, whereas thin skin, occurring on other places in the body, only has 4 layers. It is lacking the stratum lucidum. Next, in the layers of the skin, so deeper than the epidermis, we have the dermis, which is made up of 2 layers, the papillary and the reticular. First, the papillary, it primarily serves to nourish the epidermis, since it is right below, and it can contain things like some blood vessels, lymphatic vessels, sensory glands. And next we have the reticular, which surrounds various sebaceous glands, sweat glands, and it has a lot of connective and fibrous tissue. And lastly, we have the hypodermis, which is a subcutaneous layer below the 2 layers of the epidermis and the dermis, and its primary function is to serve as a way to stabilize the skin above various organs and on the body. And lastly, some of the other parts of the integumentary system, which I have kind of mentioned somewhat, include our hair, so like hair follicles, nails, sebaceous glands, and sweat glands, whether it's the 2 kinds, apocrine or exocrine, the apocrine occurring in places like the armpits or in the groin, then the exocrine occurring everywhere else, producing sweat. And the last thing I'm going to talk about is how I can use the integumentary system in my future career. So I'm planning on becoming a nurse, and the integumentary, obviously having a fundamental understanding of the body is important to being a nurse, but specifically when it comes to integumentary system, whether it could be explaining something as simple as a hypodermic injection to a patient and how it goes through the various layers of the skin and why we call it a hypodermic injection, all the way to if I'm, have a patient that's being treated for skin cancer or skin condition, I need to be able to understand what's occurring and the various roles and processes involved in the integumentary system, so I'm better able to communicate between my patient and the doctors and just kind of have a better clue of what's going on overall. All right, thank you.